Hi and welcome to this edition of the HealthHubble podcast. My name is Carrie Plummer and I'm the editor and content manager here at HealthHubble. Today I am thrilled to invite as my guest Dr. Serena Rakha. Serena is an NHS GP based in Birmingham, and as well as having an extended role within dermatology and lifestyle medicine, she's also an accomplished writer, a GP trainer, a medical advisor to Duty to Care, and a health coach. Working as a GP, Serena supports a wide range of patients within her busy practice, and now working as a health coach is looking to extend this work to inspire, educate, help and support those looking to make positive health and wellbeing choices. So without further ado, welcome Serena. Thank you so much for joining me today.
Thank you so much for having me. I'm super excited and nervous in equal measure, but thank you so much for inviting me.
Oh, it's a pleasure. So I guess for those who are tuning in and don't necessarily know a huge amount about you, perhaps let's start with who you are and what you do.
Yeah, so I'm Serena and I'm a GP in Birmingham, and I completed my GP training in 2016, and since then I've sort of stayed at the same practice where I was training, and I work 3.5 days a week there, and the rest of the time is sort of trying to develop, sort of Fit Habit GP, my Instagram page, try and connect and sort of network with a lot of people sort of just into health and wellness and using lifestyle measures to try and reduce the burden of a sort of condition that they might be experiencing. I do a couple of roles like within the GP week, I guess. So like I will, I'm sort of a GP trainer, so I supervise trainees that will soon qualify as big adult GPs, and then I do a dermatology clinic one morning a week, and that's within the practice. But recently, I guess over the last 2 or 3 years, I would say, and just from personal experience, I guess that kind of led me to where I am today. I did a sort of a lifestyle medicine diploma with the British Society of Lifestyle Medicine, and that sort of was the first year of the pandemic, and I was sort of studying alongside working as a GP. And then last year I completed my health coach training, which kind of married the two. You sort of learn the knowledge from the diploma, and then you get to apply it to patients and use that and do that as health coaching, really. So it's been it's been a busy 2 years, but it's been really worthwhile as well.
Amazing. So what motivates you? And you obviously have such a busy role, wearing lots of different hats. What do you like to do outside of clinic?
Yeah, I think so in terms of like motivation, I guess there's a couple of things. So I think, again, I think a lot of us that are into sort of health and wellness, and we know that it's worked for us, it sort of stems from like a personal experience perhaps of illness. And about sort of 9 or 10 years ago, I was really unwell. It was kind of in the middle of my training. I had to take sort of time out, and that kind of made me feel sort of that I needed to do something. It sort of pushed me. I've never been, I've had teeth out as a kid. I've never had an operation or anything major, no broken bones or anything like that. And then to be ill and to be in hospital and be a patient and see it from the other side. So I think that sort of experience that motivated me to just slowly change. And it's been about 10 years it's taken me to, I think we're forever changing, but I think that was the thing that helped me sort of push things into motion a little bit. So the patients that I see, I think all of our conversations, like the one we're having today, will be different. The one you do next week as a podcast, and the patients I speak to, everyone's so different. So we never have the same conversation twice. And I think what motivates me is that my patients actually, all of us know what is good for us, but we don't always have the time, or sometimes we don't feel brave enough to say what we want or say what's good for us for whatever reason. And I think giving people the time to do that and allow them to explain what they want to achieve motivates me as well, because actually it's never the same. I never just you never have the same conversation and advising people on the same thing. It's very tailor-made. So I get to do that in GP, and that motivates me, but certainly health coaching has changed the way I ask questions as well.
Yeah. Now, some of us may not be familiar with the term health coaching. Yeah. So what does a health coach do, and how do you work and kind of support your clients? How do you do that?
Yeah. So health coaching, I guess, I guess it sort of came from the States, and it's becoming more and more popular here in the UK, although I think there are some NHS health coaches that are available, but it's not sort of mainstream, so it's not available to everyone. But health coaching is using sort of motivational interviewing and positive psychology with someone that you're trying to support in their health, to be able to allow them to uncover the answer to their own sort of solution, their own problem that they might be experiencing or challenge. And over time, when you work with people, health coaching allows us to be able to tweak their beliefs. So it changes how they think and feel about themselves and the world around them. And then that changes their sort of behavior, and that leads to sort of have a good habit change that's consistent. So I think it is very different. We were talking just before the podcast about how sort of you know, practicing as a healthcare professional is very prescriptive in the NHS and in the UK. So people always expect to come out with a prescription to be, and the assumption is that it will solve everything, and it does partly solve. You know, you do need pain relief for a lot of things, but it's trying to use other techniques as well, such as physio, you know, such as exercise, to be able to alleviate some of that pain. So it's yeah. So health coaching is hopefully it's sort of coming through the ranks a little bit and taking more of the spotlight, I hope.
Yeah, absolutely. Now, the new year is a time where many of us are looking to get fitter and healthier, but perhaps we might get a little bit overambitious with our goals and possibly try to take on too much. As a health coach, what are the basics that we possibly need to focus on just as a really good solid foundation?
Yeah, I think you're absolutely right. I think come November, December time each year, it can be really overwhelming time, and January just as much, because what you see on TV, what you read in magazines, what you see on social media, we see and hear so much of what people are doing, and it's like, actually there's so much stimulation, we don't know what is good for ourselves, and I think that can be really good, that can be really overwhelming. But on the other side, I know a lot of people find it very inspiring and think, actually, she's done that, he's done that, I'm going to do the same, I'm going to raise money for charity and do a hike or a marathon or what have you. But I think the main thing is, in terms of sort of good foundation, is to be able, I know this sounds silly, but just to be able to take time out and figure out what your goal is. So the goal is it's not always about weight loss. And I think sometimes people think, oh, lifestyle medicine and health coaching is the people that want to lose weight. And actually, when you have those conversations with people, it's about, you know, better energy levels, or just living longer but having a better quality of life. So I think trying to figure out what your goal is, and trying to do very small things first is key. So the more changes someone needs, they need to have like smaller steps. It needs to be broken down, and one little goal may take a month or two, and then you move on to the next one. So it's figuring out small changes first, and what you can do consistently on most days of the week. So not 7 days a week. What can you do 4 days a week or 3 days? Yeah.
That's a really balanced approach. And I think that's something that at the new year, and you're quite right, is you kind of get to that build up, the amount of stuff that you see, whether that's through TV, through media, through social media, it can feel really overwhelming. Now, you have written a number of fantastic articles, which we proudly host here at HealthHubble. And one of those focuses on hydration, both adding tips on increasing your fluid intake, as well as some myth busting too. As a health coach, is this something that you factor in with your clients?
I definitely think so. I think it definitely does come up at some point. So, and it might be something that I introduce if it hasn't, you know, if we're sort of 4 or 5, 6 sessions into health coaching and it hasn't been approached, or it might come up a lot sooner. If someone is ready, they you know, you can just sort of pick up on cues, and someone say, oh, I never drink water, is that good? And then you can actually introduce that conversation. So it's when people are ready. I think it is important to have that for dental health, and to be able to have more water to substitute slowly things like coffee or, you know, fizzy drinks or what have you. I don't think anything's off the table, but I think water is important, and I think it can be aiding weight loss and helping exercise. It can reduce muscle ache, you know, if someone's exercising, and I think it's important to be able to hydrate as well, and there's loads of benefits. So I think it's definitely a factor that I take into account and discuss as well. I've done sort of experiments myself where I don't have water for a few days, and I just have coffee or juice or a takeaway coffee or what have you. You feel, I personally, I feel that it does make you feel very dehydrated. You feel tired. I'm prone to headaches. I feel really sluggish. And then when you up your water intake, you know, even if it's just by a litre or a litre and a half or something, it does make a massive difference. But yeah, I think even if people aren't keen on water, that you can stick slices of fruit in there or have like a sugar-free squash or a herbal tea, or so there's lots of ways around it to make it interesting, definitely.
Yeah, I'd agree. I mean, I know when I haven't drunk enough.
Yeah.
And it's so easy to do when you get caught up with work. It's quite an easy thing to kind of let slip, but you definitely notice it.
Absolutely.
Do.
Yeah.
So let's talk food. One of my favorite topics. Again, this time of year, we might try to start a new eating regime, and perhaps getting into that trap of classing foods as either good or bad, or trying eating habits that, you know, we're trying to get over the overindulgences from the holiday period. As a GP and a health coach, are there any common themes that you see, and perhaps some perspective that you can bring to this?
Yeah, I think definitely you were saying that this concept of good and bad food. I think there's room for all types of food, and it's just, you know, having more of the sort of unprocessed food. So things like your fruit and veg, things like home cooked foods are really important. So we do see a lot of people that have overindulged quite a bit. I think all of us would have done, and then the thing that we see is over restriction. So come January, we all think that we can radically change and restrict our food. And actually you can still have a biscuit, you can still have a piece of cake or a glass of wine, or, you know, again, it's what you do on most days of the week. So I think from speaking to patients that have sort of, we don't have a formal clinic for weight loss or lifestyle medicine yet, but hopefully we will do soon. But definitely people that come forward to us wanting to improve their health will often say that they have cut out certain types of food, but then you're sort of missing the taste of those foods. So so I think definitely over restriction, but you don't have to over restrict if you want better energy levels, or say if you want to improve your blood pressure or lose weight, whatever goals someone may have. So I think those are definitely the common themes, and people don't realize when I say actually you can have a glass of wine or with a meal, or yes, you can go out with your family, and it's like people are asking permission. But I think it's just what I try and do is introduce the concepts of sort of unprocessed and ultra processed foods, and then even things like sleep, stress, and exercise, which are non-food related but actually help quite a lot. So we don't have to focus on food so much. So I think a lot of it, people will come and see us and expect that we're going to talk about food and we're going to tell them what to eat, and it's not about that. It's just being flexible with things.
100%. Yeah. Now you've mentioned exercise. Now we all know that we need to move more, and for some of us, keeping up with that internal promise can be quite a hard task.
Definitely.
There must be times as well in clinic where you see patients that would definitely benefit from some real purposeful exercise. Can a health coach help with this, and what kind of sort of simple tips could we be bearing in mind when we look at trying to keep up on our motivation when it comes to exercise?
Definitely. I think sort of any form of exercise is really important for so many things. So in terms of improving sort of diet, sort of sugar control with diabetes, or helping someone reduce their blood pressure or lose weight or reduce their cholesterol, if that's what they're sort of focused on and that's sort of their health goal. I think in terms of exercise, it's definitely something a health coach can help with. Again, it's trying to tease out when the right time would be for that. So we always go, so in the 12-week program that I do with clients, it will come up at some point, but it's just when that person is ready, because sometimes exercise is quite daunting. People again assume, oh, I have to be in a gym, I have to weight lift, or I have to run a marathon. You don't have to. It could just be, let's start off with 15 minutes of walking each day and build up. So I think it's just layering in those habits. But absolutely, I think exercise is really important just for it's. And again, when people want to exercise, and I've had a few sort of patients that have said this, it's never about an aesthetic. It's never about wanting to look good. It's about having energy to be able to live longer and play with their kids and not feel out of breath. Or it's, you know, it's doing that, it's having the energy to do the things they love outside of the work that we have to do. And so picking something that you can consistently do, again, 3 days a week is better than nothing. I wouldn't say everyone should exercise every day if they can't. Some people don't have the time to do it every day, and they can do it twice a week or once a week, and that's better than nothing. But again, just spreading it out, because I think that's really important, is key.
And you're quite right about the consistency and actually finding something that you enjoy. Definitely. I think there's nothing worse than having those preconceptions that, and you're quite right, of having to go to the gym, of having to do a certain class. And that, you know, that's just a self-defeating thing, really, I think. Now, you did mention stress as well, and I'm sure we can all say that stress has had some sort of an effect on us in the past few months or years, whether that's due to work, whether it's home life balance, or even actually from the holiday period. What effects can stress have on our bodies, and what simple things can we try to do to help alleviate this?
So I think stress is so underestimated. I think in terms of the impact it has on health. So you could be healthy, no medication, hardly see your GP, and be massively stressed. Not in the sense that you can be on the go and you're just not giving yourself a break. And sometimes it's good in our life to have those periods of stress. You know, you feel productive, you're getting on top of things, you're achieving things that you want to be able to achieve. But in the long run, that chronic stress has huge impact on things like our blood pressure. So our blood pressure does, you know, go up a little bit as we get older. Stress can affect the food choices we eat. The things that we eat. It can affect our sleep quality, it can affect our relationships as well. So I think in terms of managing stress, it's really important to be able to do that in a way. And I think certainly over like the last 2 years, you know, where we would say, right, my stress relief is to book a holiday. Well, none of us can do that. And it's just, you know, where you'd go out for a meal. I remember, like, I think it was 2020, booking a meal 6 weeks in advance. I'm like, actually, I might not want to eat that food and not fancy that food in 6 weeks time. But it was just that lack of spontaneity we had. And, you know, nor pre-pandemic, we would just have that spontaneous way of living, book a last minute holiday or book a spa or book, you know, or see family. But now we're living like, oh, should I do a lateral flow test before I visit my family? Or, you know, what can, you know, all these sorts of restrictions that we're having to think about. So, I think the impact of the pandemic has caused a different type of stress as well, where we feel that it's loss of control of our life. And that's where I think I know a lot of my patients are, you know, that sort of older population have looked to doing sort of attending church, or have they perhaps become a bit more spiritual. Some people have tried sort of journaling at home, meditation, yoga. You know, and I think we're now having to use tools that we've never used before, and that's scary, because doing something new is you know, we don't know whether we'll like it or not, but it's just this act of sort of slowing down to help reduce that stress. So yeah, a lot of people have become perhaps more religious or, you know, spiritual, and have looked to reduce their stress in those sorts of ways as well.
Interesting. And I think there are so many options that prior to the pandemic, and you're quite right regarding spontaneity and all of this energy that we had, and suddenly having to pare that back. But you're definitely right in terms of, you know, from the meditation side or the yoga and journaling, all really, really great ways of being able to acknowledge that stress and being able to process it.
Definitely.
Now, finally, as a successful clinician and health coach, what is the one piece of advice that you would give to your younger self?
Oh, this one's a really tough one. I think there's lots of things that I've learned. So I'm turning 40 this year, and you just think it's such a milestone, and it's a thing we should celebrate as we get older, because I know, like, a lot of people will not have perhaps reached that age in certain parts of the world, and I think sort of in terms of my younger self, I would say just to not put a lot of pressure on yourself, and that things do work out, and know that things are in flow, and the things that don't work out, and there's been lots of things that haven't worked out in my life, have pointed me in, have opened up another door for other opportunities, and to live really well, and to, so just take those opportunities, and don't see, any disappointment. See as what are the other opportunities that are available, and how can I get around this, and don't always listen to the advice that you get as well. I know a lot of people have said, oh, you shouldn't do this particular thing, or this is not a good way of earning a living, or what have you, and actually we have to give it a try. And I think the more times we fail, the more we learn, and the more we know what we don't want, or what didn't work. So I think for anyone that's listening, and especially when it comes to going back to sort of health coaching and what we were speaking about today, use our body as an experiment. So try something out. It's not going to be perfect, nothing ever is, but try something for a month. How do you feel? Have you achieved anything from those changes? And if it doesn't work, that's absolutely fine. You tweak it and you alter it, and that's how you make change. Because I think if someone told me, right, Serena, you have to do this, that X, Y, and Z to achieve this, it probably won't have worked for me. But it's just knowing that use your health and your body as an experiment, really, and try new things.
I love that, and I think you're so right in terms of, certainly as a younger individual, I always thought that life was a very linear process, and there were certain milestones, and actually there have been lots of times where different pathways have kind of opened up. And so, and this is why I feel very privileged to be in this position talking to you today. So thank you so much, Serena. It's been a real joy speaking with you. It's a pleasure. Now, if you want to find out more from Serena, you can head on over to her Instagram page, which is @FitHabitGP, or alternatively, you can head over to her website, which is fithabitgp.com, which will be on the slide later. Amazing. You can also read Serena's articles here at HealthHubble by heading over to our knowledge hub at healthhubble.com. Thank you so much, Serena. It's been a real joy.
Speak to you soon. Take care. Thank you.
Take care. Cheers. Bye-bye.
Bye.